Everyone good? Okay, good morning Queensland and good morning Cherbourg. It's wonderful to be here, and I just had a wonderful meeting with the Mayor and the Council, and it's great to see that the vaccination rates are going really well now in Cherbourg and Mergen. And can I give a big thank you to the Mayor and her team. They're all double vaccinated. We've got people going door to door and we're seeing really good results here. So it's wonderful to hear firsthand how positive people are about getting their vaccine. Now today I can announce that we have 3 new locally acquired cases. So I need Queenslanders to listen to this. We're going to see more and more cases as our borders open, but I just want to go through this with people so we understand what needs to happen. So the first case is detected on the Gold Coast. The person lives at Pacific Pines, potentially infectious in the community for 6 days. Now the good news there is that they've had 1 dose of the vaccine. So if you live on the Gold Coast, now Gold Coast has not reached that 80% yet. If you have any symptoms whatsoever, you need to go and get tested. You also need to go and get your vaccine. If you have been thinking about it and wondering whether or not you should, today is a good day to go and get your vaccination. Now, we'll be putting out a list of exposure sites, and the Deputy Chief Health Officer will talk about that in a moment. Now, the second case is detected in Warwick. Now, we need to make sure that the residents of Warwick are also getting vaccinated and getting tested. They've been potentially infectious in the community for 10 days. And they attended the event in Moree. So we know where that link is. We do not know at this stage where the case from the Gold Coast has come from. So we need to make sure there are no other cases on the Gold Coast. So now I'm saying to Gold Coast residents and families, if you are not vaccinated, go and get vaccinated. If you have any symptoms, please go and get tested. Now, in Warwick, the good news there too is that they're at 78.9% first dose and 60.2% second dose, but still, that's still not as high as I'd like to see it. So Warwick and Gold Coast, please go and get tested and please go and get vaccinated. And the third case is detected in hotel quarantine, and we are not concerned about that. Recent travel from Melbourne and not infectious on the flight and was fully vaccinated. So we have 10,873 tests have been done in the last 24 hours. And the good news is we saw an increase in our vaccination rates yesterday. 13,133 vaccines were administered by Queensland Health. That means Queensland, we are now at 79.84% first dose, 67.84% are fully vaccinated. Now what that means is we'll get the Commonwealth figures in this afternoon in relation to pharmacies and GPs. So we will definitely see Queensland reach 80% tomorrow. So when we stand up tomorrow, I should be able to announce that good news, and that does mean that masks will come off. So we are very excited to be here, and as I've said very clearly yesterday, we announced a range of measures to protect Queenslanders. So if you want to enjoy your Christmas holidays, and if you want to go to the theatre, you want to go to sporting events, you want to go to a pub or a cafe or have a beer with your mate down at the local pub, I'm asking you to go and get vaccinated. I understand there are a small cohort of people who are against vaccination. Can I please say to you, if you have any concerns, please go and see the experts. Go and see your local GP or see a nurse, and there are people there that can talk through any issues that you may have. But this virus is coming. I need to keep you safe, and Queenslanders need to continue to unite to ensure that we can get through this as smoothly as possible. So I want to thank everyone for all the work that you've done. I want to thank the Mayor and the Council for having me here today. It's great to see Steve Renouf out here too with the team. They've got a community fun day later on this afternoon, and we want to see as many people vaccinated in the community as possible. So I'll hand over to the Deputy Chief Health Officer. Then I'm also accompanied by Minister Grace, And the good news there is not this weekend. This weekend we're going to have a few schools open, but the following weekend we are going to have a huge blitz, a vaccine blitz across a large number of schools across Queensland, and the Minister will be able to give us further updates about that tomorrow. So I'll hand over to the Deputy Chief Health Officer.
Thank you, Premier. As Premier mentioned, we have 3 new cases, all acquired in Australia, and that brings the total in Queensland to 15 active cases. The gentleman at the Gold Coast, a 32-year-old man, is in hospital now, and he was possibly infectious in the community for up to 6 days. The contact tracers are working very hard to identify any locations, any exposure, and to contact anyone who may be a close contact. What we know so far is that 3 family members who are close contacts, and one of those is a health worker, those people have so far tested negative, so that's good news. But the contact tracers will be working hard, and do keep an eye on the website for any exposure locations. Similarly for the case in Warwick, unfortunately that person was not vaccinated, and that person identifies as First Nations, and they were infectious in the community for up to 10 days, and again we will be posting if there are any exposure sites that you need to be concerned about, or if you've been to those locations, please do go and get tested if you are in the Gold Coast or in the Warwick area, or have been south of the border into that Moree area. If you have any symptoms at all, there's going to be probably a new testing site set up at Warwick as well today, in addition to the 7 or so other sites that are available to you, and there's plenty of testing availability as well on the Gold Coast. So I would like to just, I suppose, reiterate something that Dr Aitken said yesterday, which I think is really important, that the data coming out of New South Wales, they did a big study of their recent outbreak there, and they showed that if you are unvaccinated, you are 16 times more likely to get really sick and go to intensive care unit or to die. So please get vaccinated, and I think it's a real privilege to be out here today and help support this vaccination drive in Cherbourg.
Thank you. I want to say thank you to Premier Annastacia Palaszczuk for visiting our community. And you know, around the vaccination, our numbers are coming up. We just got to keep going, and I want to say a big thank you to the MARTA guys that's going around doing door to door. Keep up the good work, and I think, you know, my job and Annastacia and our Premier's job is to keep Queensland safe. Thank you. A couple of weeks ago, and since they've started, our numbers, the vaccination rate has gone up. Yeah, well, you know, it started, that's the main thing, and our first jab is up 70%, and our second jab is around the 50% mark. So, you know, I think by the time MARTA leaves here, we'll have 80 to 90%. Oh, there's whole heaps of reasons why. Religious reasons, and, you know, social media doesn't help. So, yeah, and then, you know, it's our job to make it happen here and change the mindsets of our people.
Apart from the door-to-door efforts, what else is the community doing to try to get the vaccine rates up?
Well, we actually had 2 super clinics. There's actually another one happening this afternoon with the Crakes, and you've got some Steve Renoff and Rhonda Purcell and Willie Tonga here, so that's happening about 3 o'clock to 6 this afternoon, so hopefully that'll bring our numbers up there too.
So, is the federal government data that's coming up saying Cherbourg has, 27% first dose, things like that, is that not accurate according to council's numbers?
No, it's not accurate because of the Medicare and the addresses and stuff, so we're just going by the postcode. Yeah. Thank you.
I might get Steve to say a few words, because Steve's out here helping everyone get vaccinated.
Yeah.
Sorry, Steve, can we get your name and title?
Yeah, Steve Renoff, Deadly Choices Ambassador. Thank you. Look, I'd just like to thank Alvy for having us all here and in the community. I'd like to thank the Premier and Minister Grace and the Deputy Cho for being up here and travelling up here for a very important cause. And I'd just like to acknowledge my Deadly Choices ambassadors that are here. So Willie Tonga, who grew up here, Rhonda Purcell, who grew up here as well, and we got Brenton Bowen as well. So we're here obviously to help encourage the community to get vaccinated. Obviously for us, this is our area. My mum grew up here in Cherbourg, and as I said, a couple of ambassadors, they grew up here. So it's very personal for us, and as I say to the community here in Cherbourg, you know, we really encourage you to get vaccinated. We all know there's an opening date coming up around the country, and we don't want to be left behind. I think it's very, very important for our community, but not just for Cherbourg as well, but for the whole Indigenous community across the state. We've got to realise that you know, COVID is coming, and to be vaccinated, and you know, we need that freedom going forward. As I said, the date's coming, and we're here to promote that in the community.
Steve, what would you say to the local community, some people that might be a little bit hesitant? I mean, having the Premier here and yourself, obviously, you know, in their minds, heroes like yourself, what would be your message to them?
Yeah, look, it's about protecting the community, and we've been saying that all along. You know, it's about, you know, I can talk openly about Cherbourg. There's been a lot of sorry business happening up here at the moment. When COVID comes in, and you know, we have people who are not vaccinated, there's going to be a lot more, and we don't want that. You know, this is our mob, and we want to protect them, and that's why we're here. And you know, as I keep saying, you know, we don't want to be left behind, and as I said, it's very personal for us.
Some of the women that we spoke to in the community said one of the issues for them with getting vaccinated is religious reasons. How do you combat that?
Yeah, well, look, I'm not right across obviously the religion side of things and what that means to different groups of people, so I really can't comment on that.
For those Steve, in the community that the hub is going on this afternoon, you've got William and the others in town, what would you say to them? They can come down, obviously, see you guys and even have a chat to you? Yeah, just come down and say good day. You know, it's been a while since I've been up here. I think these guys have been here, they were here not long ago, and you know, it's good, you know, just standing outside there earlier, waiting around, you know, everyone was coming up, and I just haven't seen a lot of people up here for a while, so yeah, just come down and say good day. And get vaccinated.
What's your worry if COVID, if Delta strain of COVID does come into the community of Cherbourg? What's your concern and how are you dealing with that?
Well, like myself, you know, comorbidity, there's a lot of community. I've type 1 diabetes, a lot of varied conditions and medical conditions here in Indigenous communities, not just here in Cherbourg, but across the state and country. And we got to stay protected because we're vulnerable. That's the bottom line. If Delta gets in, which you know invariably it will, we got to be protected.
I think about 100 years ago there was quite a significant flu outbreak around here that knocked out about 20% of the population.
Yep.
Are you thinking that could happen again?
We don't need that happening again. We don't want to repeat in history. Thank you.
Oh, thank you. And can I acknowledge Steve Renouf and Mayor Elvie, Auntie Elvie, who were past students of Morgan State High School, where we're heading out this afternoon to spread the word of vaccinations for the high school students. We've spent millions of dollars in these schools. It's been great to visit Cherbourg, and it was lovely to see the state school go through major renovation and more to come. So I'm looking forward to rolling that out, and it's completely transformed the school here at Cherbourg, and I had the Mayor and the CEO both acknowledge the beautiful renovations that have occurred at that school and how great the children are learning in their language in that school, which is wonderful to see. With Morgan State High, they didn't have a hall. Well, they've got one now. We're about to go out and have a look. I don't think that the Mayor and Steve Renouf were in the same class together. The Mayor reckons Steve was in the naughty class and she was in the good class, but in jest, of course. But it's going to be wonderful to be out of Morgan, to spread it around to the high school students as well. I think education is the key to vaccination, and the high school students have a role to play in this community, as have all the ambassadors that are here, and can I thank them all, and the role of the Mayor and others in this town. And we do need to get them vaccinated. We want our high school students vaccinated as well, and we'll be out there not only to visit the new facilities that are, you know, world class, but also to spread the word about how important it is to get vaccinated, particularly in vulnerable communities. And we don't want to
see vulnerable communities suffer when Delta comes in. So it's great to be here in Cherbourg. Thank you very much to the elders for welcoming us, and I can't wait to get out to Mergenstay High and see what we've done there. So thanks for having me.
Just on the numbers that we just spoke about, it seems that Cherbourg's numbers are way higher than what's the federal government numbers.
Yeah, we had it qualified by Queensland Health, and perhaps the Deputy Chief Health Officer can talk a bit more to it. But in relation to the postcode of 4605, that's 72.7% first dose and 55.3% double dose, but that includes outlying communities as well. But look, our job is to get everyone, as many people as possible, vaccinated. I really want to see Queensland hit a target of 90%. We need to protect each other, and the best way you can do that, and to stop either ending up with severe illness or in hospital, in ICU, is to actually go and get vaccinated. So it's not too late. There's, my understanding is that there are some schools open on the weekend here as well. And I've got here Mergen, Kingaroy and Nanango State High Schools are going to be open this weekend, and it's great to see door-to-door happening in some of our communities as well. Well, I don't release the postcode data. Yeah, no, I don't have the postcode data.
I mean, what happens, say,
Sorry,
in
Marlene?
Cherbourg, if it doesn't hit 80% double dose by December 17, what's the plan for Cherbourg then in terms of the hospital?
Well, we're all part of Queensland. So I'm saying to Queenslanders that December 17, the borders are going to open, and as we had the discussion at the council, great leadership. The council is showing tremendous leadership. All the councillors are double vaccinated. They're spreading the word out in the community, and the borders will be open. Now, there are people here in Cherbourg and Mergen, Kingaroy, all the surrounding areas, Wandai, that actually have friends and family in other parts of Australia, and they want to get together for Christmas. So there will be people coming into your communities. So that window of opportunity is closing quickly.
From December 17, unvaccinated people won't be allowed into hospitals and aged care homes because they're more susceptible to the effects of COVID. Why is that mandate not being extended to Indigenous communities where First Nations people are more susceptible to respiratory illness?
Because we are one state, and I have always tried to unite Queenslanders. That is why we are driving up these vaccination rates right across Queensland.
If governments can impose lockdowns on communities, do communities have the power to lock down unvaccinated people?
That won't be happening, but we will have, there may be restrictions imposed if there are outbreaks. And I've been very clear on that. Everyone, I've been very clear.
Hypothetically, Warwick or say the Gold Coast has some dramas tomorrow, and the next day we see numbers climb. Will that restrictions come back into play?
If we see a large community outbreak in any of those areas, we would have to look at putting in place some restrictions. Like I said, we're quite comfortable at the moment because the vaccination rates are higher than they were, 2 or 3 months ago. But it's a wait and see here. But it is a wake-up call for people in Warwick, for people on the Gold Coast, to go and get vaccinated. Time is running out. Can I say that to Queenslanders? Time is running out.
I mean, there seems to be significant fear amongst community members about getting vaccinated, even those that are vaccinated say they've been, they've been coerced into it. With the fear like this in Cherbourg, has there been some kind of failure in the messaging along the way of government policy perhaps not coming in with enough lead time to be able to?
I think it's a really good question. I think what we are seeing is our local community leadership talking about the benefits of vaccine. You've got very strong sports role models that are coming in and talking to the young people in the community about the importance of vaccine. This is a community effort. This is not just about government saying go and get vaccinated. This is a community. This is about protecting all of us. This is about protecting all of our families. It's about protecting our young children. I think families want to know if they're going to go to a theatre, if they're going to go to a restaurant or a cafe, that their children who will be under 12 are going to be safe because everyone around them are vaccinated.
Premier, have you seen comments made by the prosecuting Philip Develler on social media, obviously having a go at you directly and calling yesterday's decision draconian? It taking away human rights?
Look, my job is to protect Queenslanders and to keep Queenslanders safe, and the measures we announced yesterday will protect Queenslanders even more.
It's damaging that sort of stuff, that sort of rhetoric to be on.
It's pretty easy. They've just got to go and get vaccinated. And back to Mildura's earlier question as well, unfortunately, in some cases and in some communities, there has been misinformation spreading around on Facebook. I understand that people have concerns, and the best way that you can talk about these concerns is to go and sit down with your family GP or a nurse, just to talk about these issues, because a lot of the time when people sit down and talk about these issues, they understand what's at risk.
Do you expect these vaccination rules to be changed once we hit, if we can hit 90% in Queensland? Do you expect those rules to be relaxed?
Not necessarily. As you can see, New South Wales is driving 95%. So, we need to be, and I said this this morning as well on radio. Look, Australia has the chance, and Queensland has the chance, to be, one of the most highly vaccinated places in the world. That's going to protect our families.
What do you say to businesses that are intending to welcome unvaccinated customers or not get vaccinated themselves?
Well, they won't be able to, because it's going to be mandated by the CHO directive.
Wait, so the businesses have the right to choose if they
No.
say it. So you have to abide by.
Yes, it's going to be it's a mandated direction.
Why is the vaccination data being posted by postcode down to the local government area?
No, I think this was just given to me by the council. So the council had sent information into Queensland Health, and they verified that for me.
4605 also includes Murdoch.
It does.
Part of the South and Regional Council area, and
Yes.
vaccination rates are naturally higher than most.
Yes, well, that postcode does include, that's right, that broader region. But what we are seeing is here, people are going door to door and people are coming and getting vaccinated, which is fantastic. Sorry, Lydia?
So how do you combat vaccine hesitancy from people who are objecting for religious reasons?
Well, I ask people to think long and hard about this. This is about protecting you and your family. I understand they're tough decisions, but it's about protecting you, your family and your community.
Premier, just on the Triple C, we see another failed investigation, the former Mayor of Ipswich, that you put that in with Michelle Stenney, and you've got the Logan councillors as well. Have you lost faith in Ms Barron or what the Triple C is doing? Will there be an investigation?
Well, there's actually a PCCC inquiry at the moment, so I'd like to wait till they hand down their report. Yes.
And obviously the businesses that are going to visit hospitals under the...
Correct.
But what about healthcare opportunities? For instance, will they be, put on that of the list for surgery or things like that?
Look, millions of Queenslanders have gone and got vaccinated. This is a reward for millions of Queenslanders who have done the right thing. They know that they can go to the hospital, they can go to the aged care, they can go to a whole range of bars, restaurants, cafes, nightclubs, you name it, outdoor music festivals. Lydia loves nightclubs. They can all go there. The businesses don't have to have any restrictions on their density, on how many people they can allow, and people have to be vaccinated.
Will vaccinated hospital patients be given priority for elective surgery, for instance, in front of unvaccinated?
Look, I am going to get advice from that on health. I'll take that question on notice.
Premier, the young 27-year-old from last week who travelled from Adelaide, Cairns to Adelaide, then went to
Yes.
Melbourne. She's been selected to fine in the Northern Territory. Will you be investigating on
Yeah, police are looking at that. They'll
so
look at that.
They're most likely to be a fine here. You should.
Depends where the offence took place. Yeah.
Okay,
Yes.
Sort of your healthcare is a community and an opportunity that's used for screening and treatment for trauma. Why then was it not used to vaccinate people in March? Why has it only just come up in the last month as communities have Cherbourg and Inala?
I think we've been trying to make vaccination available to everyone through the normal channels, the usual clinics and hospitals and GPs, pharmacies. As you know, it's available in many, many locations. Obviously, as we're getting closer now to needing to get people vaccinated before the opening, we've been more creative, and I think it's down to the Cherbourg community and the health workers here to do this work in partnership, to go house to house, because that's what the community needed to get where we need to be.
House-to-house facilities be using this in years. Do you think Queensland Health is better with communities by not looking at procedures that were already in place and adapting and using those for the distribution of the vaccine?
I think Queensland Health and all of our partners, including general practitioners and pharmacists, have tried a lot of different things. You've seen pop-up clinics in schools and in Bunnings and all of these things. So we're looking at a whole range of things. And as you say, house to house is something that we know can work if that's what we need to do to to get to where we need to be. So we'll do whatever is required.
Do you have any specific modelling of what COVID-19 is Delta variant would mean, the impact on Indigenous communities, say this vaccination rate versus say Africa?
I think what we know is that unvaccinated people are much higher risk of getting the virus and of getting sick if they get the virus, and of going to intensive care and of dying. And so we know as well that people with comorbidities can be more severely impacted, so people who have other conditions, and that is a risk for people in First Nations communities, as we know and as Steve mentioned before. So I think it is really just most important that we get everybody protected and that we protect families and we protect the community. I'd have to go and find out what data we have available, Lydia, but we can get back to you with that.
Okay, thanks everyone.
Hang on, can I just clarify too, just in relation to our hospitals don't discriminate if you are vaccinated or unvaccinated, but if you are unvaccinated, you are more than likely to end up in ICU. So people need to think very long and hard, and that's going to put enormous strain on our health workers. So please go and get vaccinated. Thanks.